What about people that still have teeth, but they're really bad? They're loose, they're falling out. Maybe they were told at another dentist, we need to remove these teeth and get dental implants. So what is the process for them?
Well, for starters, this patient's going to have a lot more choices than they used to have, and a lot more choices than they're probably even aware that are available. For starters, we can take their teeth out under anesthesia, which is generally an IV twilight type of sedation. We still numb them up so they're comfortable, but after the anesthesia has started.
What about their gums though? I mean, if they have gum disease, what are you doing?
The first thing we're going to do is we're going to take out the bad teeth, whether they're broken down from tooth decay, whether they're, I'd like to say, flapping in the wind because of gum disease and there's no more bone support around them. A lot of that is disease that's associated with the tooth. So when the teeth come out and the gums heal, that source of infection is no longer there.
Okay.
A lot of these patients are going to comment to me later on, I hear this all the time, how much better they feel, how they used to never have any energy. They always just felt they couldn't get out of bed in the morning.
Because of the infection in their mouth?
Their immune system is always behind the scenes fighting that infection, and they don't even know it.
Is that
so
right?
Once we get rid of it, it clears up, they're golden.
So the gum gets healthy, and then what?
So we're gonna decide on that consultation, that first visit, what do they want their lifestyle to be like? We already know we're going to get rid of the infection. We're going to get that cleaned up. That's going to be an improvement no matter what.
Okay.
Now, what kind of teeth do they want to have? With just basic dentures, I can make them look great.
All right.
There's drawbacks. Some of these drawbacks are, a lot of people don't realize that dentures are replacing the teeth and they can look great. We do that all the time for individuals. However, there's a big part of gum replacement on there. And a lot of that's the pink part of the denture, Randy.
Okay.
A lot of that covers the roof of the mouth. That it can interfere with speech to a certain degree. It can interfere with how people taste and enjoy foods.
Okay.
Traditional dentures also, they can move around a lot. You have to have something to secure them. The most inexpensive thing is you can go to the supermarket, you can get a tube of denture paste. But the biggest complaint that I've heard, and I've tried this stuff, it doesn't taste great.
Okay.
It can be somewhat nauseating until you get used to it.
So with implants, what do you do for this denture patient? Or the person you had to remove all their teeth?
So let's go to the next level up. Okay. So you get the basic dentures for starters. There's things we can do with dental implants that will secure the denture. We call that a snap denture, or a denture that still comes in and out, but when they put it in, it's snapped into place.
Is this done on the day that you're removing the teeth? Or you remove the teeth and then they come back later?
So yes and no to both of those questions.
Okay.
The yes is the implants are placed under sedation. We get all of the procedures done like that right off the bat.
Okay.
However, with a snap design denture, I prefer to let the patient learn how to wear the healing denture, we call it, the temporary that they're going to leave with that day. I prefer to let them wear that while everything heals.
That's for the snap in, snap out.
That's correct. The gums are going to heal, the bone is going to remodel, and the implants are going to gain their strength over the course of a few months. So they're going to get a second denture. That's going to be the set that snaps in. So there's going to be a healing period there of 4 to 6 months when they're going to see what it's like to use the adhesive and things like that, even though the implants are already there, ready to go. So finally, the best option, and this is my favorite. This is what I love to do for patients. This is teeth that don't come in and out. A lot of people that have come to see me, I said they might not know their options in the beginning.
Yeah.
Maybe their parents, their grandparents had dentures, and they think that they're destined to this. It runs in the family. Bad teeth run in the family. I hear it all the time.
Okay.
So now there's an option. These patients can come in and get rid of the bad teeth, get rid of the gum disease, get rid of the cavities, fix their smile, in other words, and they don't have to do dentures. This is huge.
So they can walk in, remove the teeth, give them teeth supported by dental implants in one day?
In one day.
Okay.
And patients are blown away when I tell them that, or maybe they see it on my website, or they hear it from a friend, and they're like, come on, that's just a ploy, right? And I'm like, no, you're going to be amazed at what, I showed you my website earlier and some of the before and after pictures on there and how transforming they are. This, even though these are their temporaries, they're fixed in place by the implants. They're not coming in and out. They're going to get the zirconia, their final denture, or their final teeth, I should say.
Yeah.
It's not a denture. I find myself saying that sometimes.
And they can eat whatever they want.
They can eat whatever they want.
And then they just come in, you say annually, once a year to get them cleaned if everything's going well?
I like to follow up with these patients with what we call dental implant maintenance, and that's an annual visit. It's an hour, and we're just checking to make sure things are healing well and cleaning them for them, and they're out the door, on with their life.
So for people that don't want them, no more traditional dentures.
For people that don't want dentures, we have an answer for them right now, and it's dental implants and teeth that don't come in and out.